Hi, my name is Trent Adams. I'm a manual therapist at CRP and Performance Therapy up in Grass Valley. And today I'm going to talk to you about repetitive injuries and soft tissue injuries, how we can help you with those issues before they become a big problem. So what is ART? ART is known as active release techniques, and it's a state-of-the-art bodywork technique about movement in which treats and prevents repetitive and soft tissue injuries. Soft tissue injuries creates tightness, discomfort, weakness, instability of a structure or an injury. ART is successful in treating these symptoms and preventing these symptoms to an injury, and because it gets to the core of the issue, which we used to think it was inflammation, but it's not inflammation that's a problem, it's hypoxia that's the problem. So hypoxia is a lack of oxygen to the injury. And so when that happens, we also get what builds up a scar tissue. So hypoxia creates scar tissue as well. So scar tissue is like very sticky, like bubble gum. If you get it in your shirt, you want to try to get it out of there, and it takes tension to get it out of there. Very sticky, and it does the same thing to your muscles and tendons and nerves and ligaments, all the soft tissues. It changes the texture and the tension and the movement of tissues. And so we need to free up those adhesions, the scar tissue, to get motion that we need. So today I'm going to work with Joey here. He came in to see me about some rotator cuff issue. He's explaining the symptoms of being tightness, chronic tightness all the time. So we better address that before it turns into a big problem, a rotator cuff tear or something. So we're going to do active release techniques on rotator cuff to relieve some of the symptoms for Joey here, okay? So what we're going to do, we're going to take the arm up to external rotation. And so this muscle comes on the back of the shoulder blade and it attaches to the front of the shoulder. And it's a very dynamic muscle. So what we're going to do is we're going to take this arm internally, rotate it, and we're going to take it to the back of your pocket to where it feels comfortable. You don't want to go back too far. Okay, so let's bring it back up. And then externally rotate it. So I'm going to get on the supraspinatus and go ahead and reach for your back pocket, Joe. We're going to get right on the rotator cuff right there. Make sense of that. Great. Back up. Let's get one more pass on that. Come on down to your back pocket. Bring your arm back up, do external rotation. Go back to rotator cuff to back pocket. And I want you to take your hip forward over to that right knee forward, lateral flexion. And we're getting on those two muscles that the fibers connect right here. Do you have any kind of lesions in this treat? It treats everything from plantar fasciitis to carpal tunnel to chronic tightness, whiplash, sacroiliac dysfunction, and a whole list of other things where we're dealing with nerve entrapment or a torn muscle or just tightness. And ART is effective in about 90% of these cases, so it's a very effective body work tool.